Hi, I am Dr. Camille Ronesi, and we are going to talk about hamstrings. Hamstrings are a beautiful, complex muscle group, and we often oversimplify it into being weak or strong, tight or loose. And when we only do that to it, we miss all of the really cool treatment options we have to actually get really rapid results that will improve your knee pain, your back pain, it'll improve your squat performance, and it will improve your running performance. So here we go. First, we're going to do some quick anatomy. So we have three muscles in the hamstring group. There are three muscles: the biceps femoris, the semimembranosus, and the semitendinosus. Now, the biceps femoris is a lateral hamstring. It's the most outer muscle of our hamstring group. So that's our red muscle here. Now, you'll see that it has two places that it starts from. There is a long head that starts from the ischial tuberosity. It will also send some fibers up to invest into what we call the sacrotuberous ligament. The short head starts actually on the femur itself. It starts on that linea aspera. Those two heads come together, merge into one big fat muscle group, and they attach right on the back of the fibula and with fibers going into the lateral head of our tibial condyle. So on us, we feel like it's about right here, just behind the knee. It also is in the same place that your IT band comes down to. So when we talk about these pains that are back here, or dysfunctions back here, or IT band problems, we have to look at the biceps femoris. The other two, the semitendinosus, will start in that same spot. They all start on the ischial tuberosity. All three muscle groups start on that ischial tuberosity. The semitendinosus runs down the back of our thigh and then starts to wrap around towards the front of our shin, right on something we call the pes anserine. Pes anserine is the Latin term for goose's foot. So it's just that you have these three muscles. You have two adductor muscles and you have the semitendinosus. They come together and it makes a little triangle like a goose's foot. And it attaches right on the front of our tibia. The semimembranosus, ischial tuberosity, like everybody else, but it runs down and attaches to the back side of that tibial condyle. So we have right here, we have on the front side, we have one part of our hamstring muscle group, and on the back side, we have the other. What does this mean? Well, it means that all of these muscles, when we want to bend our knee, they all contribute, right? When we want to extend our leg, they all contribute. They all have a role to play. However, when the biceps femoris contracts, it creates an external rotation force on the tibia, right? So we get this spinning outwards of the foot. When the semis contract, particularly the semitendinosus because of its location, less so of the semimembranosus, a little bit, but certainly the semitendinosus, when they contract, they create an internal rotation force of the tibia. It is normal and expected to have a balance of rotation of the tibia. As we bend and straighten our knee, there is rotational elements that are happening at the knee. Most of the time when I see knee problems, there is an element of the rotation that is off balance, right? Most of the time is that people are stuck in too much external rotation and they don't have any internal rotation. More about that later. Now, that is the actual true anatomy of those muscles. However, we don't move in our sports and in our life one muscle at a time. Everything works as a system. Everything works cohesively as a group. When things are in balance, that cohesion is perfect. When things hurt, when we have funky alignment and do weird stuff in our gait and in our lifts, it's usually because these systems are out of balance. So let's talk about two main systems. First, let's talk about the deep longitudinal subsystem. This comes out of the work by Vleeming, Shirley Sarman, and a couple of others. Deep longitudinal is going to be your erector spinae, which are those big tubes on your back, the thoracolumbar fascia, the sacrotuberous ligament, and the biceps femoris. This system is a synergistic mover. When they contract, they don't contribute to stabilization as their primary role. When these muscles contract, it creates movement of the joints, right? So when you want to arch backwards, your erector spinae will contract and pull your whole spine into extension. When you want to extend your hip, you'll get contraction, especially of this guy, right, of the biceps femoris, and you'll also get it at the knee. Now, you cannot talk about motion at the spine and the pelvis without talking about the intrinsic stabilization system. Now, I've combined two ideas here. Intrinsic stabilization system is from Vleeming and Sarman. The deep front line is more from Thomas Myers and the work of anatomy trains. Now, there's a lot of other people that contribute to all of this. Those are some of your biggest names. Either way, these two have so much overlap that when I'm working with people in the clinic, I often think holistically about this as a unit. The intrinsic stabilization system is going to be all these guys, right? So it's everything in here, right? Diaphragm, transverse abdominis, internal obliques, pelvic floor. All of those muscles are going to contribute to stabilization. You also have these little tiny guys that run from vertebrae to vertebrae, right in here. What those muscles do, when they contract, they don't create movement of joints, they create a compressive force. That compressive force creates stability at the spine. It also creates stability of the relationship between your pelvis and your spine. So that way when they contract, the pelvis, instead of it going all crazy like, it has a cohesive movement that matches what the spine needs at all times. When people have problems, when they have a weak core, they lose that relationship of protecting the spinal movement. They lose that relationship of what the pelvis is doing in relation to the spine. They lose that relationship of what the sacrum does in relation to the hip bones, the ilia. Now, when you look at the deep front line, which is the work by Myers, when you look that one up, you're going to see that the adductors are in there, right? So you're going to see that there's some adductor muscles. The semis are rarely mentioned in a lot of these systems. They kind of get glossed, which is too bad. I do tend to think of them more in line with the adductors. They share a lot of the same origins and insertions of many of the adductor muscles. They also are the same physical space. Then they may share some fascial lines as well. So what does that tell me? When I look at somebody who say they have knee pain when they squat, or runner's knee, and then when they run, they maybe collapse in, or they overpronate, or quite the opposite, they super supinate. There's somebody who's always on the outside of their feet. When they're hypermobile, these are all things that tend to reveal themselves as having a very weak core. They have a very weak intrinsic stabilization system. They don't do a good job of recruiting it first, which means that say they want to do hip extension, right? They go to move, and they have nothing to control this relationship of pelvis to spine. They don't have that compressive force of their intrinsic system to hold the pelvis in place. So as the hamstring contracts, yes, this bone will move this way, but the pelvis will also move, right? Because it's experiencing that contractive force of the muscle on the bone. So then your body, knowing full well that it doesn't want the pelvis to move, it will instead do something like contract the six pack, which will hold the pelvis in place, right? So once we have that rectus abdominis firing, or maybe your hip flexors, anything that will keep this relationship stable, we now can start to move, but we just fired muscles that have a reciprocal inhibitory relationship with these. In other words, when they contract, they tell these muscles not to fire as hard. Or when they contract, it's much harder to get much range of motion out of this because you're getting force in the other direction. All that to say, we tend to get too much activity from these big movers and not enough activity from the stabilizers. Let's go back to the semis and the biceps for just a second, and then I'll put it all together and show you how it works. When someone doesn't have good stabilization of their pelvis or good work from their feet, and they say go to do a squat, we'll see a couple of different ways that they solve the squat problem. Their first method is to spin the feet out and to duck the knees in. right? So the feet will spin, they'll pronate down, and the knees will cave in. So we're putting the tibia in relative external rotation, and then as the knees cave in, the femur is rotating inwards relatively, right? That gives the biceps femoris a lot of advantage, right? If the tibia is already spun this way, the biceps femoris is now positioned to be the primary mover for hip extension. It becomes the primary force that you can drive from when it's time to stand back up. So when you go to stand back up, the biceps femoris is lined up to be the guy, to be the one that does it. And the semis are going to have a really hard time providing that contributory force of guiding the tibia back into place with its internal rotation, because it's so out of place, right? If your feet already spun out and you go to stand up, the semis aren't going to be able to contribute what they can to that knee extension. Gives you a really weak feeling squat, gives you a lot of sensation of tightness right here, which you then start claiming as an IT band tightness. It's not, it's that hamstring. You also are missing some of the stabilization force at the knee. Now, what do we do about it? We need to activate the intrinsic stabilization system. We need to activate the semis. Most of the time, these folks show that they have very weak medial hamstrings and a very strong, not necessarily tight, usually they have full range of motion if we test it, but they have a very strong biceps femoris. If I can activate the core and activate the semis, all of a sudden it's a lot easier to control the rotation of the knee as you go in and out of your squat. Now you don't have that torque right here on your knee. It also allows your pelvis to go through its range the way it's supposed to go in relation to the spine. So as you're going through your squat, you're getting this consistent patterning of pelvic motion to spine motion, and instead of dumping all of that force into your low back, into your thoracolumbar fascia, you are now able to distribute that force from the ground through the entire system, through this entire pelvic load, through this entire intra-abdominal pressure system, and you can press a weight up, you can jump yourself up higher, you can compress and then load and then spring up through whatever dynamic move you want to do, being able to summate all of those forces. So let's show you how it works.
All right, so what we're going to do is we need to put some active release on the biceps femoris. This muscle tends to be long and overactive, so a long static stretch doesn't really work for most people, because what they actually need is just to get it from over-firing. So we're going to release the biceps femoris, which is that lateral hamstring, and then we'll do some other exercises to activate your medial hamstrings and your glutes. So a lacrosse ball works really well. If this is too intense, a tennis ball, especially a used tennis ball, will work really well also. Another option is to get a hold of maybe one of these larger massage therapy balls, Grid or any other brand you find out there. It's about softball size, works really well. Sitting on a chair, just enough that your feet have some space with the floor, and then you'll take that ball and simply stick it towards the outside of your thigh. Allow your leg to rest on it until you find a few spots. Yep, if you just kind of move laterally a little bit, kind of across it, you'll find it. Once you find it, stay on that spot. It's going to be a ball of intense pressure, and then straighten the leg and bring it back down again. Now, if you feel nerviness, like some tingling or stinging down your leg into your foot, you need to move where the ball is because it's pressing up onto a nerve. You don't want that. So we're here about 1 to 2 minutes until you feel a release. Certainly you can stay at the end, maybe do a little point and flex, which won't do a ton for the hamstring, but it will start to kind of wake up that lengthening chain of having some calf length while also having some length in the hamstring. So if we really want to ramp up the biceps femoris activity, what our goal is to create length and inhibition in the biceps femoris, but we also want activation in the glutes, right? We want the glutes to be more active, and there's 2 ways to do that. There is activating the glute medius, which is more of an abductor, or the glute maximus, which is more of hip extension with some rotation in there. So if I want to activate the glute medius, which is everybody's favorite corrective exercise to do, and you're tired of doing clamshells, this is the trick. So you put a band on, you move out just enough that you can feel it. Trust me, it is not a lot of force. You go out too far, it's going to be a fail. It's just enough to create just a little bit of feed and pull that way. We're going to set up for that active biceps femoris lengthening. Same way, kickstand this leg for balance, slight toe turn in just a little. Connect to the ground through the ball of your big toe. Make sure your knee stays in line with the second toe and the leg is very straight. And we're going to do that same coming down and squeezing the coming up. Don't worry about anything else, you'll do it automatically. If you're not feeling much work, come out just a little bit more. And rinse and repeat. And as you're doing this, as you're moving down and up, this band is pulling you this way, right? That we call that reactive neuromuscular training. What we're basically doing is feeding the mistake. When you feed the mistake, you're feeding it just enough that the feedback is so loud that you respond to it, right? That's whenever we use bands, that's what we're doing. We're trying to create a reaction to generate a force. Now, if I do it just the right amount, I can already feel it. This hip muscle here has to be active or else I'll fall over. If I go too far, I have to correct too much, right? Now we're overfeeding the mistake. You want to feed the mistake just enough. So we have the band just tight enough, coming down and out, up and in. And you do this until you feel like it's actually easy. You might feel like you're on fire. I always tell people the rep count is when you're sad. When you just can't take that muscle is just burning and on fire. And that's it.